Hello there, and welcome to Dr. Z's Health Education Project. I'm Dr. Zaidi, and in this video, I would like to talk to you about the treatment of diabetic retinopathy. Diabetic retinopathy is retinal damage due to diabetes. Over time, diabetes damages the blood vessels all over the body, including the blood vessels that supply blood to the retina. Over time, that damage can result in blindness and vision loss. So if you have diabetic retinopathy, what can you do? Well, there are two main approaches to what can be done. First and foremost, what you can do. And then way over here in this small column, I'll put what your doctor can do. Notice how I've put what your doctor can do on the side here, and what you can do is the most important. I'm going to write here, most important. 90% of blindness from diabetes is preventable, and it's preventable by things you can do. What can you do to control and to treat your diabetic retinopathy? Well, here's a simple way to remember, control your A, B, C's. Control your A, B, C's. Well, what does A stand for? A is your hemoglobin A1c, and you want that to be below 7%. I ask a lot of my diabetic patients, sir, ma'am, what is your hemoglobin A1c? And they say, doctor, I don't know what you're talking about. I don't remember. It is very important that you know your hemoglobin A1c and you strive to get that hemoglobin A1c measurement below 7%. Hemoglobin A1c is a blood test that gives an average measurement of your blood sugar over the past 3 months. You want that average blood sugar measurement to be below 7%. If it's 8% or 9% or 12% or 14%, it's way, way too high. You want your blood sugars to be under control so that your blood vessels in your retina remain healthy. So A is hemoglobin A1c. B, blood pressure. Think of your blood pressure as the water pressure inside a pipe. You know that if the water pressure is very high inside a pipe, over time, that can damage the pipe. Similarly, if the pressure inside of your retinal blood vessels, which are very tiny, tiny little blood vessels, is too high, it can damage those blood vessels over time. So you want your blood pressure to be 120 over 80 or below. The last component is C, and that is cholesterol. You want to keep your cholesterol under good control. You want your total cholesterol to be less than 200. You want your LDL, which is your bad cholesterol, to be much lower than that. By controlling your hemoglobin A1c, which is a measure of your blood sugars, by controlling your blood pressure, and by controlling your cholesterol, you can save the blood vessels in your retina, save the blood vessels in your hands and feet, in your heart, in your brain, and in your kidneys from getting too much damage, and you can protect your vision. So now you're going to say, well, doctor, how do I control these things? Well, let me just say, it's not just taking pills. It's not just pills. Controlling your blood sugar, your blood pressure, and cholesterol is not just about taking pills. The most important things you can do are eat a healthy diet, weight loss, and exercise. These are things that you can do. Eat healthy, lose weight, and exercise. These are not easy things to do, but these are critical in controlling your ABCs. And if you have questions and want advice about how to control your diet, weight loss, or exercise, talk to your doctor about that. Very, very important. Hopefully now you have a better understanding of what you can do to treat your diabetic retinopathy. Control your blood sugar, control your blood pressure, and control your cholesterol. In my next video, I'm going to talk about what your doctor can do to treat diabetic retinopathy. See you in the next video.